Another comparison, I call it side-by-side comparison, when we had two implants side by side. So in previous patient you had one side of the mouth with immediate implant and the other side with delayed implant, and you remember that even with 4 free surgeries we were not sufficiently successful to regain the contour of delayed implant, while in immediate implant placement I just preserved what's there. I did not really need to regain what's lost. I just need to preserve tissues after implant placement. So side-by-side comparison. For me, these clinical pictures tell everything. So you see the difference in the profile of the restoration, because first molar was placed immediately, and the second premolar, which was already missing, was placed in delayed approach. The difference between individual healing abutment and standard healing abutment, these clinical images show why it is important to have individual healing abutment, even from composite. Well, I think we are thinking too complicated, thinking that, composite as a material for individual healing abutment is something not sufficiently good enough. Yeah, zirconia is better, I mean titanium probably as well, but even the composite, if you are doing it correctly, because later we will understand, so what part of individual healing abutment is really responsible for this preservation of the profile. So it's really not difficult to understand. But anyway, you see the immediate implant placement really gives you a perfect profile, which is much worse compared to delayed implant approach, which at the end of the day results in different profiles of the restoration. Immediate implant restoration, you see, is like a tooth-like, and delayed implant restoration is like implant-like. So tooth-like, implant-like restorations. That's a fair and good comparison, that with immediate approach you can have tooth-like restoration, and with the delayed approach you can have implant-like restoration. A good visualization from the occlusal point of view, you see the lack of the tissues with the second molar and the preservation of the tissues with the first molar. That holds in situation that this implant is actually more prone for food impaction, which results being more prone to plaque accumulation, and which leads to more prone to perimplantitis. So I would say that immediate implants, if done correctly and restored correctly, probably are less prone to develop perimplantitis because of the contours, natural contours of the tissues are preserved compared to those contours which are lost in delayed implant approach. Well, what I learned from my experience with immediate placements in the same patient, immediate delayed comparison between nearby implants, I learned several things. First of all, immediate actually is much faster, and I would say much better than delayed, if of course indications allows to place those implants like that. Even with multiple augmentations, which we saw in cases I showed, it is still difficult to regain what's lost. I would say it's impossible to regain. Now, maybe it's good enough. Well, maybe it is okay for posterior region, and probably for anterior it's not good enough, but again, this is, the level of our perfection. So if we can provide the patient with unchanged contour of the restoration, which is less prone to perimplantitis, why wouldn't we do that? And last but not the least, that zero bone loss can be developed in both approaches. Here we must really divide two things: bone stability and soft tissue stability. It's not the same. Sometimes you can have bone loss and the tissues still be stable. And sometimes you can have no bone loss, zero bone loss, but if you are lacking the contour of the restoration, contour of the soft tissues, I would say this is as bad as having bone loss. Next thing we need to discuss when we talk about rationale for immediate implant placement is specific advantages